Good morning. My name is Jennifer Overton, and I'm CRS's Regional Director for West Africa. I'd like to welcome you and all the participants to this very first ICT4D Malaria Elimination Conference. And this conference comes at a very important time. We're at a critical period in our fight against malaria to eliminate malaria around the world. We all know that malaria cases and deaths have globally plateaued. But investments focusing on localization, such as the High Burden to High Impact Initiative, which focuses on 11 countries with the highest malaria burden around the world and trying to get them on track with their elimination goals, these investments have potential to change this plateauing trend. And actually, thankfully, according to some recent data from WHO, all the high burden to high impact countries responded well during the COVID-19 pandemic, with only moderate levels of disruption and access to malaria services, which is a very promising sign. Going forward, initiatives such as the High Burden to High Impact Initiative, which focus on localization, both in terms of leadership and in tailoring malaria interventions according to the local context. These types of initiatives will be critical to sustain gains and critical in helping us reach malaria elimination. Digital technology also continues to play a very big role in this initiative. And as the world and endemic countries become more digitalized, we need to continue to build systems and tools that can help us reach our malaria elimination goals. While these digital tools are not a solution to the problem, they can be critical in helping ensure we are targeting the right resources with the right transmission dynamics. There are other critical lessons learned from different areas of the malaria community, but also outside the malaria and health community, that we must learn from in order to ensure we create robust and sustainable health systems. If Ebola, Zika, and now COVID-19 have taught us anything, it's that there's a need for digital tools to be able to help respond to old endemic diseases such as malaria, but also to novel disease outbreaks. In addition to the malaria tools themselves, it's important that we also keep in mind the people that we're serving with these tools and with our malaria elimination interventions. We've got to consider the people behind each of these tools, behind the aggregated data, and behind the systems. This conference aimed is to bring together the best and brightest minds working to improve the quality and timeliness of malaria programs by using important digital tools. But let's not forget that there might be a pregnant mom or a sick child in our discussion as we consider these digital solutions. My ask over the next few days is that in discussions that we have and the connections that we make and the recommendations that come out, we keep in mind who we're working for and what our ultimate goals are. I'm now pleased to introduce today's keynote speaker, Dr. Sonachi Ezeiru from CRS's Nigeria Country Program, who is leading the Global Fund Malaria Grant alongside the National Malaria Elimination Program. I wish you much success in this week's conference. Thank you.
Ladies and gentlemen, I am Sonachi Ezeiru, the Chief of Party, Global Fund Malaria at Catholic Relief Services, Nigeria. I am pleased we can gather today to discuss digital advances in malaria elimination. I am honored to work in this life-saving field, which has brought me in contact with countless partners, experts, and individuals. As we strive to bring impact to those we serve, I am motivated daily by the dedication of the people I work with and the many lives that are saved because of the work we do. As a young girl growing up in Nigeria, I was often afflicted by malaria and cannot count how many times I missed school. Malaria almost cost me my final year examination in secondary school. I will not forget that experience. It is therefore not a surprise that I have joined forces with many around the world in the fight against malaria. According to the most recent World Malaria Report, Nigeria accounts for 27% of all malaria cases globally. 27% is a staggeringly high number. When I hear data such as this, I remind myself that despite the progress we have made in Nigeria with malaria control, more effort and resources are needed to reduce the burden of malaria, especially in the most vulnerable groups, children under 5 years of age and pregnant women. Please permit me to share with you our journey in the digitization of insecticide-treated net campaigns in Nigeria. In 2017, Nigeria took the bold step of digitizing net campaigns, beginning with a pilot implemented by CRS in collaboration with the National Malaria Elimination Program, NMEP, and funded by the Global Fund to fight AIDS, tuberculosis, and malaria. The location of the pilot was a local government area in Kwara State, north central Nigeria. Prior to this, all ITN mass campaigns were paper-based, and some of us here may be familiar with the challenges of using paper-based tools in an activity as complex as the ITN mass campaign. With the digital tools, the field personnel could quickly register households, calculate nets per household, and log their distribution, while allowing supervisors to monitor field activities remotely. All data was synced to an online platform for simplified reporting and analysis. The platform has various permission levels, ensuring sensitive information is only accessible to key personnel. Following the successful conduct of the pilot, digitization of ITN mass campaign was scaled up in 2018. The results have been transformational. Accountability, efficiency, and transparency in the campaign process have all improved. Tracking of trading attendance, registration of households, and distribution of nets are now done with digital tools. In addition, the real-time availability of data through a GIS-enabled platform facilitates quick decision-making by the program managers and key stakeholders. The digitized geospatial data has improved registration coverage as it helps direct teams to areas that have not yet been visited. Other benefits of this mobile technology in the net campaign include real-time feedback from field teams and a reduction in delays of payment compensation for campaign personnel. So what have we achieved with this transformative approach? Since 2018, we've worked with NMEP and other partners to distribute 52 million nets through mass campaigns. Of this number, 47.7 million were distributed using digitized tools. We now have experience using over 6,000 smartphones equipped with digital tools and platforms to effectively collect, analyze, and use campaign data. Together with NMEP and other partners, we've tracked the training attendance of 76,000 household mobilizers and reached 23.8 million households. With the overwhelming success of the digital tools, use of digital tools during the net campaigns, NMEP has embraced these digital tools and has expanded their use to other interventions. In 2021, NMEP conducted a pilot of the digitization of seasonal malaria chemo prevention, SMC, in Gombe State, northeast Nigeria. Plans are underway to scale up the digitization of SMC in 2022 and subsequent years using a phased approach. CRS has partnered with NMEP to strengthen existing structures and support relevant stakeholders. We have set up a working group with NMEP to share best practices and support development of similar technology-based programs. Beyond the obvious achievements is the capacity development of locals who have been trained to use Android phones to collect, analyze, and use data. We have equipped them with skills which they would otherwise not have received if there were no net campaigns in their communities. CRS's partnership with NMEP is critical for the success of our collective efforts to prevent malaria. Our other partnerships and collaborations with local and international organizations are also essential for the success and sustainability of these efforts. We have worked closely with state malaria elimination programs to provide oversight for malaria interventions and increase capacity for monitoring, evaluation, and data generation. With these great solutions at our fingertips, where do we go from here? As we look ahead to future possibilities in Nigeria, we continue to work with NMEP and national and international partners to further explore new ways to digitize other aspects of the malaria program. The success of these digital tools also indicates a need to expand their use beyond malaria campaigns. Many other health campaigns and activities could benefit from digitization. Mobile technologies, as we have seen, have the capacity to improve health outcomes, save countless lives, and bring us closer to malaria elimination. In conclusion, what are some key takeaways from this successful transition from paper-based data collection tools to digital ones? We have identified 3 of them. First, investment in technology has provided unparalleled transparency into our work and has fundamentally changed the way we implement mass campaigns. Technology gives us more tools to help us put an end to malaria. It is clearly a worthy investment to make as we continue to implement these campaigns. Second, the use of technology in malaria programs enables quick decision-making and better outcomes in reaching intended target groups. It also allows countries to harness the power of data and scale up interventions. These digital data collection and management tools can help address major implementation challenges and improve current practices. Third, and finally, countries and their partners are thinking about how to make these technologies more sustainable. This includes providing technical assistance and training to build the skills of those using digital tools. To enable a truly sustainable system, national malaria programs will need to work collaboratively with other programs in the Ministry of Health and increase engagement with other sectors. There couldn't have been a better time for this conference when the world is getting back on track to accelerate progress in the fight against malaria. I wish you all a fruitful meeting under the themes of harnessing the power of data, reaching intended target groups equitably, partnering for scale, and sustainability. Thank you.